Most people think high blood pressure only happens with age, but what if your daily habits are quietly pushing you towards hypertension? Let's talk about with Dr. Vasudeva Rao, diabetic specialist and consultant physician and director of Anantam Hospital with 40 years of experience. What is hypertension?
Okay, thank you for giving me the opportunity to speak on hypertension. Today is World Hypertension Day, 17th May, and the whole purpose of having 17th May World Hypertension Day is to see that people all over the world understand the importance of this silent killer hypertension. Well, to begin with, hypertension is a silent disease. It's a chronic high blood pressure state wherein there is significant elevation and persistent elevation of blood pressure, which can slowly but definitely contribute to target organ damage. So every part of the body gets slowly damaged, right from brain, heart, kidneys, nerves, etc., and it can be very, very severe. So it is imperative that we all understand about the details of this blood pressure disease on this World Hypertension Day.
If I have no tension, will I still have this disease?
Well, as the name indicates, hypertension, unfortunately, the real meaning is not, if you have tension, you get hypertension. Hypertension is a term which is basically coined to convey that the blood pressure is on the higher side. So if you have tension, then stress, which is the actual form of tension, can play a big role in contributing to high blood pressure. But if you have tension, that doesn't necessarily mean that you have hypertension. Hypertension is a disease which is classified scientifically as a BP more than 120/80, and it is a diagnosis to be made by the physician. Just having a high tension doesn't qualify you to be hypertension.
So, what is an abnormal BP?
Okay, so let's talk about what is normal first. So when you have a BP up to 120 divided by 80, that is the upper value 120, the lower value 80. Upper value signifies the systolic blood pressure, the lower value signifies the diastolic blood pressure. So when you have a value above 120/80, we call it as elevated blood pressure. So it has a various stages. For example, we say elevated hypertension, wherein the BP range in the upper value is between 120 to 129. The lower value is around 80. Then you have stage 1 hypertension, where the BP goes from 130 to 139, and the lower value goes between 80 to 89. Now, stage 2 is beyond that, that is 140 and above, and the lower one is 90 and above. Then comes the most critical labeling of the blood pressure, which is called as very, very high blood pressure or malignant hypertension or accelerated hypertension, wherein it can be more than 180 upon 120 millimeters of mercury. So blood pressure classification is not a one-time diagnosis. It is to be made in due course of time.
So what are the symptoms of hypertension?
Symptoms of hypertension are rarely, up to 90% of the times, you don't have any symptoms. So when you talk of symptoms, like most of the patients do get headache, blurring of vision, or you get palpitations, you get chest pain, you get breathlessness, and sometimes swelling in the feet. These can be correlated as symptoms of hypertension. But in 90 to 95% of the cases, they don't have symptoms. You have to actually visit to your family doctor or to the nearest doctor and actually check the values on the mercury barometer or even otherwise in the electronic meter and actually confirm whether you have blood pressure or not.